I remember the day that Lydia walked to my desk and said, is the state of environment name something that's protected and, only certain governments can use, or can we actually produce a state of environment indoor air report? So that was the start of my job of saying, is the term state of environment protected or not, or can anybody use it? And that's sort of the basis of how this report developed. Yeah, thank you. So I just wanted to spend a little time today introducing this report to you, so you all have it on your chairs. I guess the starting point was, first of all, looking at what are state of environment reports. So back in 1972, the United Nations developed the UNEP, United Nations Environment Programme, with the aim that we need to monitor the environment in order to provide the scientific evidence to support policy. And since about 1985 internationally, or 1995 in Australia, a lot of nations have been producing state of environment reports. So my first role was to read all of Australia's state of environment reports that they've produced and the state ones that have been produced already. And these reports are generally reporting somewhere between every 3 and 5 years of monitored results of outdoor environment conditions. So they report on the land, the water, the ambient air quality, etc. So in doing that, I guess the basis for starting on thinking about this report is what is it that we know about indoor air quality, and what are all the things that might impact on air quality? So interestingly, the combination of Lydia's extensive research experience and my less extensive but still long research in a different area. So my areas are in energy efficiency, renewable energy, building regulations, but also social things and disaster recovery centres, building policy, etc. So combining all of these thoughts to, can we have a holistic approach to looking at what do we actually know about indoor air in Australia? So in looking at the state of environment reports, which are all quite good in what they're presenting, but there are 3 main knowledge gaps. They report generally only on ambient air quality, generally the health and wellness aspects of air, whether it's ambient or indoor, only started being reporting in Australia in 2021. But the biggest challenge, I guess, surprise for me was that even in these reports, they were saying that there's little link or limited link between multiple portfolios. So I wanted to see what sorts of portfolios don't consider indoor air. So some examples are that Australia has a national action plan for the health of children and young people. We also have a national asthma strategy, but neither of those 2 strategies include buildings and what happens in buildings as part of the solutions for managing the thing. From my area of expertise, which is more in the energy sector, buildings are not considered part of the energy infrastructure, but buildings account for energy use and greenhouse gas emissions and have to have a certain amount of energy efficiency and renewable energy. But if we address indoor air quality in buildings, it's going to impact on the energy use of buildings, which will impact on the carbon emissions. So we need to consider that as well. And there's also that indoor air quality is not considered, at least until recently, in any education policies or building plans for schools, despite there being significant scientific evidence that poor indoor air quality can lead to both chronic and episodic diseases, as well as absenteeism, concentration, cognitive issues, etc., etc. So that was sort of the first impetus, I guess, for the report. The second is, and I think everyone in this room would agree, that buildings are actually a determinant of health. So unless we tackle how buildings are designed and operated and what we do in those buildings, we're not going to fully develop a healthy society. So it was a combination of those 2 factors, both the lack of the environmental reporting about air quality in buildings and the acknowledgement that buildings are a determinant of health that led to the decision to actually try to produce this report. So the purpose of the report is this is a baseline report, so it's not a once only and won't ever happen again. The expectation is this provides what we know right now, and there will be repeated reports, perhaps 2 yearly, 3 yearly, where as more data becomes available we can do things about it. But the aim of what we've included or excluded from the report is to actually be a catalyst for discussion and debate that will lead to the development and implementation of a indoor air strategy. There are 2 objectives for this report. The first was just to collate and review existing evidence. So this is, unlike a lot of the things that Lydia referred to in the past, this is just relating to scientific papers that have been published in peer-reviewed journals, so no conference papers or no books, that have actually measured one or more of particular pollutants in Australian buildings. So it's the quantified data, and then from that data to try to evaluate what do we actually know and what don't we know about buildings. So that's the start. In December last year, Thrive hosted a one-day forum with quite a few people online where we were drawing the initial links between how is indoor air quality related to health, to greenhouse gas emissions, to climate change, to energy emissions, to dynamic optimisation or how building ventilation systems can be part of the solution, and to collaboration and transformation. And it was the feedback from that forum that helped determine what would be included and excluded in this report and how it might be structured. So the context, so we use that then, so the context or the methodology for developing and formatting the report was driven, from my perspective, on 2 things. The first was on what do any Australian regulations currently say about indoor air quality, and what are the pollutants that we should perhaps focus on in the first instance, because you can't cover everything all at once. You'd never get a report finished. So my main area of experience in the last 20 years has been on building regulations, so that's where I started. So the National Construction Code I guess, is a model code that each state and territory is responsible for ensuring what happens in buildings. But the national code most states accept what the national model code is. And the code sets out what are the minimum requirements for protecting the safety, health, amenity and sustainability of buildings. It's all of those are in the goals of the code. And it's supposedly a performance code, so there are performance requirements that buildings are meant to demonstrate that they achieve in the design and construction of the buildings. So in air quality, there are 3 requirements that must be met, theoretically at least, that in the legislation that must be met regarding air quality. First of all, that occupied spaces in buildings must maintain adequate air quality. And that's the exact wording of the code. And I want you to remember that word, adequate air quality. Secondly, that contaminated air must be disposed of so it doesn't cause a problem somewhere else. And the third performance requirement is that mechanically ventilated buildings must control harmful contaminants. That's all that's what's in the code itself. Then the Australian Building Codes Board publishes an indoor air quality verification methods handbook. So this handbook is not part of the code, but it provides advice to the building industry on how can they meet those performance requirements. And in this handbook, there is a table of 8 contaminants and limits, concentration limits for those 8 contaminants. It's also worth noting that we already have mandatory indoor air quality sensors in all buildings and in multiple spaces in all buildings already, and they're our smoke alarms. So we already have a precedent for having monitors of air quality. In this sense, it's just for the factor of identifying if there's an air quality issue that might be associated with smoke and fire to give people enough time to evacuate the building. So it's not to do with health per se, as opposed to get out of the building before you burn type of thing. So that's really important to acknowledge. The second set of legislation that deals with air quality is WorkSafe Australia. So this again is a model set of codes nationally that each state has to then put into their regulation regarding workplace health and safety. So I haven't examined each of these state-based WorkSafe things, but I will talk a bit about what the model code proposes. So the code requires businesses to do three things, in essence. That businesses have a duty to manage work health and safety risks of air pollution that happens in their businesses. They have a requirement to provide and maintain a work environment that is without risks to health and safety, and that they, in essence, need to adapt a risk management approach. So businesses need to be able to identify what hazards might be in their workplace, when they might be present, what sort of level of risk they might pose. So these are requirements of WorkSafe Australia and requirements for every business in Australia, and that relates to not only the workers in those businesses, but any persons who go into those businesses to buy things or have services. And then WorkSafe Australia also, they produce work exposure limits at the moment, and that's going to actually workplace exposure standards at the moment that will actually change to limits late next year. So interestingly, it's the risk assessment approach that is what WorkSafe Australia deals with. So, and this is a five-step approach, which is first of all manage the risk by eliminating or minimising the contaminants that might be in the building, to monitor the contaminants if there is a health risk, to monitor the health if the risk is actually quite high, to implement a hierarchy of controls regarding dealing with that risk, and to keep records. These are requirements in the WorkSafe Australia. And then in the slide before, we saw that one of the words was, as far as is reasonably practicable. And some people have said to me, well, that's what businesses use to actually say, well, it's not practical for me to do this, therefore I won't. However, if you actually read through the model codes, it says these are the 5 steps of this circle diagram. These are the 5 steps that a business is required to go through to show what is reasonably practicable. You have to be able to, what is the hazard or risk? What might happen regarding that hazard or risk? What are the ways that we can use to manage that risk? And what is the cost of doing that? And is it disproportionate to the benefit of managing that risk? So businesses theoretically throughout Australia should be following this process and documenting this process as they go. The next set of things regarding how do we structure then this report, I've decided to structure it according to the different types of buildings that we have in Australia and using the classifications that the National Construction Code uses. This is because each different type of building presents different pollutant risks. They have different occupant types, different density of occupants, different time of exposure, etc. So we need, in order to develop a national strategy, we need to understand what does that mean for each of the different types of buildings. So in the report, I first of all wanted to find out how big a problem is it? How many buildings are we actually talking about? So this slide presents the number of buildings of each of the classes of buildings that are in the construction code. So for example, we have about 11.3 million houses or residential properties. for 26.6 or so million people. That's of earlier this year. For all of the other buildings, all of this data comes from a national report, the Commercial Buildings Baseline Report or something from 2022. So it lists the number of buildings and also the square meterage of each type of buildings. So if we're talking about, for example, office buildings, there are about almost 130,000 office buildings and almost 160 million square metres of office building space. So if we're talking about monitoring indoor air quality inside each of these buildings, we're talking about lots of sensors. So we're talking a huge challenge, I guess. So the idea, so in each of the chapters of this report, you'll find at the beginning what is in essence the scope of the buildings that we're talking about. And then our last step was looking at what contaminants will we actually focus on, because we can't do all contaminants in the first instance. So we combined the recommendations that were in the blueprint document that Lydia talked about before with the 8 contaminants that are listed currently in the Construction Code Air Quality Handbook with the World Health Organisation guidelines from 2021. So it came up with a list of 10 pollutants. It was these 10 pollutants that we then used as the keywords in a systematic literature review. So this document does not include papers that talk about mould, and it does not include papers that talk about airborne pathogens. We had to draw the line. It's not that they aren't important, it's that we had to start with something. Subsequent reports need to certainly include those things. So we did a literature review looking only at peer-reviewed scientific papers from 4 databases. And what did we find? So we're only also looking at papers published since 2000. We identified 106 peer-reviewed publications that encompassed about 2,000 buildings. We added to that data from NABERS indoor environment quality ratings. So NABERS energy ratings have been going on for years, and they're mandated for office buildings over 1,000 square metres, but their indoor environment quality ratings are voluntary, and they've been going since about 2009. So we got all of that data, and all of the ratings that have happened since 2009 encompassed about an additional 450 buildings. So that means the total number of buildings that are in the data set that we're talking about today represents less than 0.03% of our building stock. So any information that I present from this point forward is only talking about a very small number of buildings over a 25-year period. So it's a snapshot of what we know. It's not a definition of what we know. We mapped each of those publications to where were the studies done, so we get an idea of what states were doing studies, what climate zones were doing studies. And it's I don't know if that's clear enough for you to see. It's really easy then to see from that mapping that there's a very uneven distribution of studies between state jurisdictions. For example, compare the number of studies done in Queensland compared to the number of studies done in Tasmania. There's an uneven distribution between urban and regional settings. About 99% of the papers are done in capital cities, not in regional cities or even regional towns or urban or non-urban areas. There's a vast uneven distribution between climate zones. There are no studies done in the northern and central climate zones. There are 4 out of our 8 climate zones that have no quantified indoor air quality studies, for example. And there's also a disparity between research organisations. 75% of the papers were done by QUT or in Queensland or Curtin Uni in WA. So it's also where expertise develops and where people can get funding for to do particular studies that sort of impact on things. So the findings are also snapshots in time. I was interested in knowing what types of pollutants are studied over time And so first of all, I did an analysis of how have ambient air quality standards changed over time and how have building codes changed over time. And we divided the papers into 4 time zones. So papers that were looking at measurements done prior to 1998, when the ambient air quality standards were introduced in Australia. The period between 1998 and 2003, when we had ambient air quality standards but no building codes. Between 2003 and 2016, when energy efficiency requirements started being introduced to all buildings, and then from 2017 onwards, when those energy efficiency standards increased quite a bit, and requirements to leading towards renewable energy, etc., came into being. So all of the papers in each of the chapters are being presented according to those timelines as well. So as a collective of all 106 papers or so, the papers do present a number of insights into a range of indoor air quality conditions over time. They highlight some of the contributions. They quantify the importance of source control, ventilation and filtration as some of the strategies for improving indoor air quality. Interestingly, they provide different multidisciplinary approaches. Some of the papers are by aerosol scientists, some of the papers are by building engineers, some of the papers are by medical scientists, etc. They all have different approaches, all valid approaches, and there's different solutions and strategies that can be applied. However, as a collective, there are also limitations. So first of all, the limitations, as we're only looking at 10 pollutants, we're only looking at peer-reviewed published papers. But the limitations also are that in each of these studies, the measurement timeframes were very short, from 1 hour up to, in a few instances, 1 year. So there are no studies on continuous monitoring for a long period of time. Most of the reports were only also about a small number of rooms or zones within a particular building. Some, it might only have been one area being like the lounge room in a house, for example. Generally, the papers talk about the mean pollutant concentration with minimal discussion about peak concentrations. There's generally a lack of analysis about the duration of concentrations at different levels. For example, concentrations at a 1 hour or an 8 hour average or a 24 hour average, and limited data in lots of studies about other things that actually impact on that air quality, such as occupant density or the volume of the room. And in order to be able to put in some solutions from a ventilation point of view, you need to know what the volume of the room is, not just it was a classroom, or how many people, what size is the classroom, etc. So there are limitations to the studies as well. So I'm just going to flick through a few of these slides. So there's a number of things that we know about our homes. First of all, the 2 most common things that were reported about homes were the impact of combustion devices. So gas appliances essentially, but also wood fire in some states. But the influence of combustion devices as an internal source of pollutants, and infiltration in particular from transport emissions and from ambient air such as bushfires. So infiltration and combustion. But what we don't know from the studies, and I think the household studies account for about 80 of the 106 papers, we don't know if indoor air quality in our housing is good or bad or adequate. We don't know whether it's improving or getting worse, because these studies were done over a 25-year period, and there were no repeat studies of the same houses done every 5 years or something like that. We don't know how widespread poor indoor air quality might be. We don't know whether indoor air quality is worse in some states than other states, worse in regional areas than in cities, worse in apartment buildings compared to detached houses, because the vast majority of papers were about detached houses, and only, I think from memory, 3 or 4 papers were actually about apartment buildings. So there's a lot that we don't know. And for that, first of all raises questions to me because the issues of combustion devices and traffic emissions also arose in most of the other building classes as well. So my initial thought from a cross-disciplinary multi-portfolio approach is, as low-hanging fruit, what would happen if we, for example, banned gas appliances in houses and schools and all buildings, and we electrified as much of the traffic transport as we could, particularly commuter cars. These things in themselves are already part of Australia's climate change target or carbon reduction target, or our electrification of housing potential that the National Construction Code is considering, or the electrification of transport, the energy affordability. Just those two things in themselves are already potentially a good alignment with existing policies. So I won't go through each of these, but you'll find in the report that there are things that we know and don't know about offices. An interesting thing about offices is that offices relates to any business that provides a professional service. So you might think of your standard office at a university or at a government department, for example, but an office also includes, for example, general practitioner's surgery. But are the ventilation requirements in a part of a building where it's a GP surgery different to what happens to the offices beside it or above it for other things? So there's no, in the codes, no differentiation between the types of businesses that are run in offices. Shops and warehouses we know very little about, other than some interesting studies that often show that the mechanical ventilation system is not scheduled or operated in response to how the business is actually working, like what the shopping hours are or what the dining hours are in restaurants, for example, or the different occupancy patterns that you will have at different times of day. We know very, very little about factories, but a few things that stood out for me, and one we'll discuss a bit later, is that small businesses have different challenges and different opportunities than big businesses. So, for example, Forex Brewery, a large brewery in Queensland, has a different way of managing CO2 emissions from their operations than what a microbrewery does. And it has different implications for how is our workplace safety requirements put in. But generally we know very little about factories. There's information about hospitals, about public buildings. Public buildings, if we talk particularly about schools, it's really important to consider where schools are placed from a town planning perspective, because quite a number of reports about the traffic emissions and the impact on young children. Then there's things about residential care as well. Residential care is perhaps the most unique class of building because it's home to the people who live there. It's also a community venue. It's a everyday workplace for some professionals. It's a itinerant workplace for other people, and it's a pseudo-residence for the family and friends that come to visit them. So there's multiple things that happen in an aged care centre. Disaster management is another one that we'll look at a little bit later today. So private bushfire shelters, there are no data studies about that type of shelter, but it does raise the question about, do we actually need other types of shelters? And I note that there's a paper being presented later this week about clean air spaces and how residents might be able to develop a clean air space in their homes, and what implications there are for public evacuation centres. So just quickly to finish, what is it that we want? And for me, first of all, when I read in the construction code that there's a requirement for adequate air quality, is adequate what we're aiming for, or are we after safe and healthy? And is that an opportunity to, first of all, change the word in the building code? And is the risk assessment process that we looked at before a mechanism for understanding where are the other gaps in knowledge? Is it gaps in scientific knowledge, or is it gaps in translating that knowledge into practice, or disseminating that knowledge to the people to the businesses that are meant to be doing this process to show that they're meeting their obligations? Or do we need more information about how do we actually get the health costs included in the benefit cost analysis process that's required in all regulation? So the purpose of the report was this is a baseline, so it's not the be-all and end-all. If you notice any mistakes in it, they're mine. Tell me about them and we'll fix them on the next round up. But getting it right depends on a whole range of things, and it's not just the indoor air quality. We need to consider the local climate. We need to consider the building itself and its geometry. We need to consider the occupants, how they occupy it, who they are. We need to consider how the building is fitted out, what its HVAC system is, etc. We need to consider outdoor and indoor pollutants and airborne pollutants, all of those things together. And arguably, we also need to consider what all of that means in a changing climate. What does it mean for our disaster and resilience management strategies? What does it mean regarding our net zero targets and our need to not put in more greenhouse gas emissions? And what does it mean from a cost-benefit analysis? So all of those things are things that we need to consider as we move forward. So the rest of today's program, we have 3 panel sessions that are aimed to explore some of those issues regarding what does this evidence, as small as it is, what does that mean in terms of going forward for science, for practice and for policy. But for now, your job, your task is actually to get together, and we're going to follow Rafat's lead to go outside and take a photo of the whole group first before you're allowed to have a cup of tea. The longer you take to do that, the less time you have for a cup of tea. So can I please encourage you to save all your talking and chatting with each other until later, and we'll have a photo first, then morning tea, then back here in half an hour for the panel. Thank you very much for your time.